Malaysia recently proposed a mutual recognition on COVID-19 vaccine certificate with Australia. A similar arrangement with Singapore was mooted last month. How would this vaccine certificate look like and what criteria or guiding principles it should have? We talked to health policy specialist Dr. Khor Swee Keng.
The first guiding principle is to have an underlying technology that recognizes the vaccination status of the people in Malaysia or Australia who have actually received the vaccine. And it may sound very simple to have an electronic system, but it needs to be an electronic system that is reliable, tamper-proof, fraud-proof, crime-proof, and reproducible, because at some point a Malaysian traveling to Australia or an Australian traveling to Malaysia will need to have a way for us to verify that this is indeed a vaccination certificate that was issued by a competent authority in these countries. The second guiding principle is to consider a solution that is firstly bilateral and then scaling up to something that's multilateral. So a bilateral solution is easy to start with, but you must build in scalability, and that's an important guiding principle. Scalability in the sense that we don't want to have Malaysia and Australia having one channel, Malaysia and Singapore having another channel, Malaysia and Hong Kong having a third channel, and the European Union, for example, and then China and then the US are imposing their respective channels on Malaysia. Thirdly and finally, a guiding principle will be, as far as possible, to use international organizations as an anchor for the regulatory standards that are needed for vaccination certificates, that we shouldn't really be doing our own thing in a corner of Southeast Asia, but we should really be mindful of the global and international trends.
Besides being vaccinated, Dr. Khor said there is also a need to prove the presence of antibody in an individual to allow for cross-border travel.
A vaccination passport only proves that you've received the vaccine. And that is important, but not as important as an antibody passport to prove that you are indeed immune from COVID. What I mean to say is, even if you have been vaccinated, your immunity status may wane or rather drop over time. And therefore, it's important to prove that you have antibodies against COVID, which is, I think, a higher standard than just merely the fact that you've been vaccinated.
And what needs to be done to establish a mutual recognition vaccine certificate with other countries? According to Dr. Khor, appointing a designated ministry would be the first step.
The first thing and the best thing that the Malaysian government can do is to appoint one ministry to lead these efforts. We can imagine a Ministry of Health wants to get involved, Ministry of Tourism wants to get involved, Ministry of Foreign Affairs wants to get involved, Ministry of International Trade and Industry, and finally Ministry of Science, Technology and Innovation. Each of these 5 ministries have got a reasonable claim to be the lead agency in creating a vaccination infrastructure to document or prove that you've indeed received the vaccinations. But when you see that each of these 5 ministries will have, say, competing priorities, competing interests, perhaps their own political agendas, there will be massive confusion if we were to have 5 different ways just in Malaysia to have a vaccination passport.